How much does it cost? That's another big factor. I like to think of it as you're not adding something, you're just exchanging it. You're not buying products that you don't already use, you're just using more effective products. Reach down in the bottom of your goodie bag and you'll find a solid gold coin. Well, someone in the back is saying someone didn't get a solid gold coin. Well, in that case, talk to Dr. Peldyak and he'll be talking about where your gold is later today. Tooth eruption time, I mentioned before, this is a great opportunity to establish long-term protection. If we can use xylitol at these critical moments at the time the teeth are erupting, I believe this is where we're going to have the best effect from a public health standpoint, from our children's standpoint. And this is really going to be an important area for you to consider, is these periods of tooth eruption. Xylitol does two things. It enhances the initial mineralization. That tooth is just coming into the mouth. The enamel's not fully developed. And it blocks that initial strep mutans colonization. It blocks the acid germs from latching onto that tooth right away. And if we can prevent that initial colonization, we have a better chance of not having the colonization later on. Especially this early childhood caries problem, it's a tragedy. Some of these can easily become hospital cases, very expensive, very dangerous, and it shouldn't happen. We like to have the moms using xylitol products, xylitol chewing gum, and the babies getting a xylitol gel. Mixed dentition is a time when the baby teeth are coming out, permanent teeth are coming in. That's a great time to be using xylitol. We should start before the first permanent teeth come in, so the teeth are erupting into a clean environment. Here's a typical American child. She eats whatever she wants, whenever she wants. And that's the result. That's what you see on the teeth, these heavy sugar plaques. But even a short period of time using xylitol, that plaque becomes very loose and it's easier for them to brush off. Over here, for example, we have the brace on. Very difficult to maintain good oral hygiene when the braces are on. You see the gums are getting very red and puffy. But again, a short period of time, 2 weeks of xylitol use, and already you can see the gums tightening up, looking much healthier. Periodontics, we're going to talk about this a little bit more also. We've already mentioned it. Xylitol helps. We really need more study in this area, but I have seen it in my own practice that xylitol helps the periodontal situation. Now, a lot of dental interest in xylitol in children's teeth, but we've kind of been ignoring the other end of the spectrum. The mature generation has exposed root surfaces. They can't take as good a care of their teeth. They need xylitol also. Dry mouth, here's a partial list of prescription medications that have dry mouth as a side effect. And it's not just uncomfortable, but it's very dangerous for the teeth. Take out your little nail board, and originally what I had in mind was a piece of sandpaper that you would lick with your tongue repeatedly, and I was told that's not a good idea. So instead we have these little, you can just rub that on the inside of your thumb and get some idea of what it's like to have dry mouth. You try to live with that and chew with that, and it's miserable and it's very dangerous for the teeth. I know I've experienced it myself, and it's something you want to avoid. Xylitol, we believe, can help these situations. Special needs situations, people who have digital dexterity problems, hard for them to brush their teeth. Again, when I was in the hospital, I was using xylitol because I had no use for a regular toothpaste. You have to brush and expectorate and so forth, but the xylitol is always there. It's always handy. I had the xylitol gel that was very refreshing. Just squirt it in as often as you need it. Conclusions. Our patient management goals in our office is a low bacterial counts, arrest of the caries process, and the patient maintains excellent oral hygiene and satisfactory nutritional intake. Xylitol, we see it as an essential adjunct that's complementary. It doesn't eliminate brushing, flossing, and so forth, but it's complementary to other oral hygiene procedures. Xylitol is underutilized, obviously. We're here, we're learning about it. How do we get the word out to everybody else? Recommendations for xylitol use can be individualized to individual patient needs. Other points to remember: xylitol tastes good, like sugar. Again, if it weren't as identical almost in taste and functionality to sugar, we wouldn't have as much interest in it. For instance, there's a 4-carbon polyol that Dr. Mackinnon mentioned, erythritol. It's very similar to xylitol, but it doesn't taste as good. So that's an important point. If it doesn't taste good, you're not going to use it. It won't be as good as xylitol. It's lower calorie. It might be helpful in weight control, lower glycemic, steady energy. Can replace all or part of sugar in a product. And that just depends on the application. Prevents tooth decay, ear infections, which may help reduce antibiotic use. Improves calcium absorption, may even improve gut function. In our constipated society, we could probably use a little bit of xylitol. But too much, too soon, when you're not used to it, oh, okay, you could have a laxative effect from it, but give yourself a little time to adjust. Small amounts of xylitol in these dental products are not going to cause a problem. Remember that dental health is extremely important. This should be a wake-up call for us, but don't wake up like this fellow with his morning mouth. Let's use xylitol. Don't take any unnecessary chances. Xylitol is inexpensive insurance for your teeth. And this is what it's all about. Healthy, happy, smiling, young faces. We love to see that. So thank you very much.